Hi, everyone. Welcome back to the Accomplished Brain podcast, where we talk about chronic neurological disorders, brain health, and other current health topics. So today we're going to talk about the vagus nerve, or some people call it the vagal nerve. There's a lot of information going on about the vagal nerve right now, especially as mental health is such a big topic nowadays. And I think, what we're going to talk about today is what is the vagal nerve? What does it do for us? And, Andrew is going to have a really great breakdown on how to actually apply that, which has always been our biggest thing is pathology, how to actually apply that to clients, and what Andrew has found success with his clients, so on and so forth. So I just want to make a couple notes of things that I've looked at over the past couple weeks getting ready for this podcast on the vagal nerve. There is a ton of research that you can find out there on the vagal nerve and what doctors, practitioners are using it for in a rehab setting. There is a gentleman by the name of Dr. H.R. Berthoud of LSU's neurology lab, who states that there's very good evidence for a role in vagal nerve in nociception. So we know that as kind of sensing heat, pressure, so on and so forth. A lot of people think of that as well as in terms of pain. But there's a huge role in nociception with emotional responses such as increased blood pressure, and tachycardia. And that's kind of controlled by central reflex pathways involving the amygdala and other parts of the nervous system. So where is the vagal nerve? The vagal nerve originates in the medulla, and it exits the skull via the jugular foramen. So, and this is where it gets very complicated, and I'm sure Andrew can give a really good breakdown of this too, but there continues to be branches and then branches of the vagal nerve. So there are two ganglia on the vagal nerve, superior and inferior, as it exits the jugular foramen. So it has branches in the neck, and these branches are the pharyngeal branches, superior laryngeal, recurrent laryngeal, and superior cardiac nerves. So already we're talking about the vagal nerve is going to have effect on our mouth, on our throat, and cardiac, right? So on our heart. It also has branches, anterior branches and posterior branches in the lung, forming the pulmonary plexus and the esophageal branch. So now we're talking, inhalation, exhalations, lungs, so on and so forth. And lastly, it has gastric branches that supply the stomach, celiac branches that supply the pancreas, spleen, kidneys, adrenals, and small intestine. So, Andrew, as far as like when you hear common things of, what does the vagal nerve do? We usually think of, oh, it's with heart rate, it's with blood pressure. But when you kind of look through the studies of where these branches of the nerves are working through, it has effect on our throat, our lungs, our heart. But, you talk about things like it has effect on the pancreas, the spleen, the kidneys, adrenals. So now we're talking, I don't know, is there a hormonal effect that happens when the vagal nerve is stimulated or when it's shut down? So I think that's really interesting. And, learning from you, it was also huge when it comes to learning about concussion and nausea, is that, the vagal nerve works with migrating motor complex in the digestive system. So, there's a very deep layer to this vagal nerve that is definitely to be taken into consideration when we talk about neurological issues. But, there also should be concern when it talks to gut issues too. One interesting thing, I listened to Dr. Huberman from the Huberman Lab podcast. And, a big thing in research is that 80% of the messages of the vagal nerve are afferent, right? So from the body to the brain. And Huberman talks about, he did a study with in his lab with food and how it communicates from the gut to the brain and its impact on satiation. And so Huberman's really big take on it is more of that it's just a really, really big pathway for our gut to communicate to our brain, and whether that's processing sugars or processing bacteria or, whatever it is. I think that's very interesting. And, as far as, today, what vagal nerve stimulation is being used for on like a clinical scale, it's a lot of things. We're talking about rheumatoid arthritis, anxiety, depression, nausea, epilepsy. Andrew, I think you can probably explain epilepsy a little bit better than I can, but I was doing some reading from the Epilepsy Foundation. They did a study where they implanted a nerve stimulator on one of the branches for those suffering from epilepsy, and it's a very simple surgical procedure. They did it for a large group of their clientele, and in a year's period, for over 40 people who were in on this study, seizures went down by 50% from just having a vagal nerve stimulation system in their
Wow.
body, which is like incredible.
Wow.
So, that stuff is pretty amazing. And I think, Andrew's really going to kind of break down of the talk about why it can help anxiety, why it can talk about depression, so on and so forth. Um, the last thing I'll say, which I think this kind of sums up a lot of what's important about the vagal nerve, is I read a study published by Robert Howland of University of Pittsburgh Medical Center, and this is a direct quote from his research article. Various forms of paced breathing can also influence brain electrical activity, which might be mediated by vagal nerve stimulation arising from the diaphragm. Cardiovascular respiratory stimulation of the vagal nerve may explain some positive emotional and cognitive benefits of deep breathing, yoga, and aerobic exercise. And this kind of just puts it back to like when you and I first met, talking about a concussion case, of just how important diaphragmatic breathing is. And it's pretty cool to years later, look up on research from guys all around the country talking about how simple stuff like diaphragmatic breathing can have a huge, response from an emotional perspective.
Absolutely. 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 Yeah. So, Jeff, I thought that was excellent and well said. I really think, the more and more we do these podcasts, I enjoy the first parts and listening to some of the research that you're doing, and I get to learn. So, I wanted to share that tip to people. I know a lot of people say, Jeff is, and in very kind words, Jeff has said, hey, it's great of learning, but I think learning is universal. I think learning, we all learn from each other. I think, when I was looking to set out to do what we're doing, it was more about like we're learning from everybody, and we're very respectful and grateful from everyone's work, and we're putting like our a little bit of our own perspective experience on it, and the goal is for people to keep growing that perspective, right? So I think it's really, and I'll share this from an energy standpoint. It's really about consciousness and passion. And when you have that and you connect very deeply to whatever you call as a creator, some people say God, some people say it's the universe, whatever it is. But when you connect at a very high level and you have an intent, and when I say intent is you want to see people happy, healthy, you want to see people grow, you want to do really good things. I think it's, you realize that we don't own any of the information. What we're doing is, and what we're doing is we're learning from each other, and we're coming up with our own perspective, and we're expanding on what other people do. So, I really enjoy these first parts because it's a chance for me to get to learn a little bit from some Jeff's, time and energy and passion. and some of the articles that he is looking at, researching, and getting ready for, this podcast, so we could share to everybody else. So I just wanted to point that out, and that was very well said. So, let's get into the vagal nerve. So the vagus nerve, and I'd like to bring up, if it's okay with Jeff, we bring up a little bit of a diagram in our course,
Mhm.
core concepts in functional neuroscience. And we always like to say homage to our friend Mike, who actually did all the diagrams. I was a conceptual guy, and oh, that's not what I want. Let me just go into here. Hold on one sec. Okay, so let me go like this. Okay. Okay, so we're going to share this screen here. Okay, so I just want to go into, just so people have like a framework on like where that actually is, and they could tell. Just go back into here. Okay, perfect. So here is our picture. We reference this picture a lot. We call this the Neuraxis. And obviously up on top where it says L and R is, we're looking at the person, like we're facing the person. That's why the L is where it is, right? Because it's kind of their left. And that's your cortex of the brain. And it has four lobes: frontal, parietal, temporal, occipital. The bottom here with this blue piece is your sublayer of the brain. That's where your thalamus and your hypothalamus is behind there. Your thalamus is a projection area. So all information except for smell must reach the thalamus before it's a relay area, before it hits the brain and cortex. Okay. And then below, we have this three boxes with a CB on the sides. The CB stands for your cerebellum, which is your coordination part of the brain. The orange is your upper brainstem mesencephalon. Your green is the pons. Your blue is the medulla. That's your brainstem. And that is where a lot of activity happens. So if you notice here, where it's small, but you could see where it says 9, 10, and 11, 10, and these are your cranial nerves, uh, and that's your brainstem, and 10 is your vagus nerve. So vagus nerve is one of your key parasympathetic activation. So we talked about this before, that the autonomics is really important, right? Autonomics, so things are happening autonomically, right? You're not really thinking about breathing unless you're doing a breathing exercise, right? But breathing, heart rate, pulse, temperature, oxygen, those are all autonomic functions, digestion. And there are two areas. Well, there's many areas, but I would say your hypothalamus, okay, which sits behind the thalamus, has some of the parts of the hypothalamus. And I think one of the, again, every time we do a podcast, it's interesting that we talk and we really get into this. And I say, oh my God, we should do a whole podcast. We get our topics actually each time we do a podcast, because
Right.
you talk about something and you're passionate. You're like, you know what, maybe we should do a podcast, because the hypothalamus is really a cool area, which where all your hormones originate. So your hypothalamus is there. Some of the areas of the hypothalamus project into the brainstem for the autonomics. And then the vagus nerve is very huge for the parasympathetic side of the uh, autonomic nervous system, which is the side that usually calms us down, which is the side that, not all, but is a side that many of us, including myself, needs to have that parasympathetic stimulation. Okay. So the thing is, with the parasympathetic stimulation, what does the vagus nerve do? So the vagus nerve is very important for, so we'll say a couple things. One, it's very important for speech, for swallowing. So those are your motor parts of the vagus nerve. Your sensory part of the vagus nerve is, there's an area called your phalanx, and in your throat, in your phalanx, the back part of the phalanx, they call that the posterior part. The front part, they usually call it anterior. The posterior phalanx is there for taste. Now, taste is really important because taste fires into an area of the brainstem, which is probably, I would say, probably more pons. It's called your NTS, right? Pons and a little bit of the medulla. Your NTS stands for, your N is in Nancy, T is in Tom, S is in Sam, is your nucleus tractus solitarius. Now, it's a part of the nucleus tractus solitarius, has an up part and a down part, right? So the up part gets activated usually when you have taste. Okay, so these are afferents of when you have taste. So an example is, so you'll receive taste from the front part of the tongue. That's cranial nerve 7. Okay, you'll receive taste from the back part of the tongue. Okay, that is that's the glossopharyngeal. That's cranial nerve 9, and then you'll receive the NTS will receive information from the back part of the phalanx. Okay, so the NTS is there also to help calm us down, because that's the top part of the NTS. The bottom part of the NTS receives information from baroreceptors. Now, this is very interesting. The baroreceptors are remember Jeff and I talked about the nervous system is all about receptors. It's all about like information receiving and then sending to somebody else, and then traveling through some kind of pathway, activating different areas. I mean, that's how the nervous system, it's your electricity part of your body, right? And it's like if you have a Tesla, and I'm an Elon. I'm not a Tesla. I don't have a Tesla yet, but it's a car that I desire to have one day. I'm a big fan of Elon Musk, right? And I think what he's doing is all about about being a humanitarian, which is all what Jeff and I are about. And my wife is an incredible lady. So, and a great mom. So if you look at the Tesla, the energy part of the Tesla is the battery, right? So all the mechanics cannot work if you can't turn the car on, and the car, it's power. Well, that's the same thing with the brain and nervous system. So the baroreceptors are receptors that stretch, and when they stretch, that's how they get activated. When they get activated when they stretch, and when they stretch, they send an afferent to the vagus nerve, which sends an afferent to the parasympathetic system to calm the system down. Well, the baroreceptors you have, and that's also, so it's basically like your baroreceptors fire, they activate your NTS, the NTS activates your vagus, the vagus activates the parasympathetic system. The NTS, the nucleus tractus solitarius, is, we said the top part gets activated with taste. The bottom part is with these baroreceptors, right? These baroreceptors get activated in the carotid sinus of the neck. So breathing. Just regular breathing exercises, or breathing during aerobic activity, right? Whether it's walking, running, okay? And then there's these baroreceptors that are in the aortic arch. So the eccentric activity of the continuous running. So what happens is that this is why it's very important. And again, I have another topic that we like to use is brain stimulation looked upon what happens to anaerobic and anaerobic activity. So aerobic activity is just continuous training, And what's happening is the blood flow back to the heart, right? And back to the right atrium, or the right atrium, right ventricle, to the left atrium, to the left ventricle. And when you're getting this continuous um, exercise, what tends to happen is that the blood flow coming back to that right atrium, right ventricle, then it moves to it fills into the lungs, and then the pulmonary system, and then the left atrium, left ventricle, and then that left ventricle, what happens is it has to get wider, right? It's not only getting thicker this way, but it has to get wider so more blood could fill the width of that left ventricle. And off of the aorta, there's these baroreceptors, right? And they stretch, and when that stretch sends a signal, okay, it sends one signal to your NTS. The NTS, which is the lower part of your NTS, sends a signal out to the vagus, which then sends a signal out to your parasympathetic, which basically causes these vessels to eventually dilate and causes all this good parasympathetic, really good digestion, motility. So motility means that the migrating motor complexes, so the smooth muscles in your stomach can move the food through the stomach and the tract, right? So, and also uh, with people with SIBOs, they'll help because the migrating motor complexes can close the ileocecal valve, which is a valve between the small. Hold on one sec. Excuse me. Which is a valve between the small and large intestine. I just need some more water. So the vagus nerve is really, really very powerful, and it could be indirectly activated with all sorts of brain stimulation. So whether you use your eyes, whether you use your vestibular system, whether you use your muscles, the vagus nerve is being activated all the time, because as Jeff and I talked about, you could see in our course, it's called Core Concepts in Functional Neuroscience. Functional means that everything is communicating together, right? So one area can influence another, which can influence another. That's functional. So indirectly, if you give an eye movement, if you give a vestibular exercise, if you give a balance exercise, if you give sound, if you give, if you give movements of your limbs, they can indirectly activate the vagus nerve. Now, directly to activate the vagus nerve, what did we say? We said that one could be breathing, right? Humming, gargling, because there's also a gag reflex. So also when you gag, so if you stick something down your throat, right, and your palate, your dome comes up, and you gag, that's another direct way of activating the vagus nerve. And then obviously another way that we wanted to talk about is using a TENS unit with an ear clip, because the ear clip, okay, and I need to come back and do a little more research of why everything's on the left-hand side, but it is on the left ear that we usually activate the vagus nerve. And we have the tragus, which is here, and up here we have, which is in the ear. And usually the ear clip, the fat part of the ear clip, goes on the inside of the tragus, or we have up in the ear here called the symbicontia. It's a little bit higher of a stimulation, and it's the auricular branch of the vagus nerve. And I've used it with myself. I've used it with family. I've used it with family, friends, clients. I use the vagus nerve a lot, and I use it, and Jeff could probably say the same way, is that I use it.
Got it right here.
And I used it today. I was having, I don't know, I think I haven't been as strict with some of my foods in the last little while. I mean, I've been good with my diet, but I've been eating some foods that I think my stomach has been reacting to, whether it's dairy and it's my own being. And I realized today that I needed to get back to using the vagus nerve. So I used 15 minutes probably this afternoon, and I'll probably use 15 minutes tonight. And what that auricular branch did for me was, one, there's a cholinergic, so choline, right, is the neurotransmitter. It's the chemical that stimulates that pathway. So the cholinergic anti-inflammatory reflex, which basically activated a reflex that decreased the inflammatory response in my digestive, and obviously the immune cells sit right behind 60% of the immune cells sit right behind the digestive wall. So if here's the wall, 60% of your immune cells sit behind that. So that is just an amazing thing. When you do vagal nerve stimulation, you could have, digestive, but you could also have immune modulating effects, because a lot of the immune system, when you're modulating the immune, it's decreasing inflammation. So you could do that with the immune system from let's say, your fish oil, your vitamin D's, your resveratrols, your curcumins. You can use those type of things, but also you could come in and use vagal nerve stimulation, and I do that a lot. Now, the vagal nerve stimulation, as Jeff could say, it has an nociceptive response. So that means it can modulate pain. Okay, so that's another thing. So inflammation, pain, improve swallowing, improve speech. Okay, the other things that we've seen and why pain, one of the reasons is a neurotransmitter that is heavily used to modulate pain is serotonin. Well, serotonin is like, wow, we were talking about serotonin when we were talking about sleep, right? Because if you think about it, what did we say? We said, the key factor in sleep is what? We said that one of the things, your cortisol has to be low. Your serotonin is a precursor to make melatonin, right? So serotonin and melatonin have to be high with sleep, and your cortisol has to be low. So the thing is, if you need melatonin, you need a precursor to make serotonin, right? So he said that serotonin is important for mood. It's also important for modulation of pain, and it's also important for your first levels of dulling the pineal gland to fall asleep, to make that increased melatonin, and you're hoping your cortisol levels are low. So there's a lot of things that we do. Obviously, also the vagal nerve stimulation to activate the parasympathetic system is going to overall calming effect of the nervous system. So what happens when people have, and I can take this off, what happens when people have seizures, right, or headaches, is basically they can't come back. The nerve cells can't come back to that -65 rest. So they're spontaneously firing all the time. That's what your seizure activity is, right? So how do you get down to the neurons back to that -65 rest period? Well, you need to activate the parasympathetic system. Well, we talked about green leafy vegetables, right? Your rugulas, your kale, your spinaches. We talked about that, right? Because they have high magnesium. Magnesium inhibits the sympathetic system, and then potassium activates the parasympathetic system. Well, another way that we can activate the parasympathetic system is through vagal nerve stimulation. So I just think that, in our model, we are probably more, Jeff and I, more exercise stimulation based, but we couple the nutrition. Now, that doesn't mean that it can be the other way, where somebody does more, nutrition, they're more into functional medicine, and they do a little bit of stimulation. That could work very well too. I think it's both sides. It's depending on, where your comfortability is. I think Jeff and I think nutrition is extremely important, extremely, food, supplements. But I think our both of us probably come from a more exercise base. So we're probably more looking at it from the stimulation, but we recognize how important the nutrition and the supplements are. But so the vagus nerve is just huge. Again, to review, the vagus nerve, the branch that we use is in the tragus of the ear over here, or the sympaconcha up here, but mostly the tragus. It's on the left side. I need to find out why it's only on the left side, but right now I need to research that so I could get back to all of you guys, and I will, or Jeff and I will. And the vagus nerve, very important for swallowing, for speech, uh, and then activating the parasympathetic nervous system, which helps calm the system down. It's also really good for improving your digestion, the migrating motor complexes, and the motility. So being able to move the food through your digestive tract, also to suppress any inflammation in the digestive system, which we said the immune cells 60% of the immune cells sit behind the digestive wall. So it's going to help modulate the immune system, because a lot of the immune system modulation is all about suppressing inflammation, which is in general all of modulating most disease, is finding where your inflammatory, your inflammatory areas are, and plugging that. The other thing is that it can help increase serotonin levels, which again, the serotonin can help modulate pain, mood, and obviously we talked about sleep. The other thing that it does is it can help. There's a lot of research on improving headaches, seizures, and also your neuroplasticity. So what happens is that the brain works with, one, you have certain areas that get activated, but then you have a group of areas that get activated, which they call that neural networks. And what the vagus nerve does is, so whatever type of rehab you're going to do, it helps the whole network around where you're stimulating. So whatever rehab you're going to do, the rehab can improve its ability to plasticize and make change through activating vagal nerve. Now, this is very interesting. I've used with a lot of stroke, or people who have tumors and get spastic, and I've seen that whatever rehab we do, that their motion in their arm or hands will vastly improve, much better by just not only doing whatever rehab we gave them, but doing the rehab with the vagal nerve stimulation. I've seen it, and I've had colleagues. I'm working on a case now with a colleague that is in Atlanta, very good guy, Tony Davenport. If you're in Atlanta, look him up. He's very, very good for nervous system, peripheral, for spinal cord injuries, for strokes. Very, very good. And I'm working a case with him, and he's really good with the bioelectrical physiology, so electrical stim, and he has just great units, and he uses the vagal stim all the time, coupled with the brain exercise software that I have conceptually designed. So it's working out really well. So the other thing is neuroplasticity. So there's so much involved. I've used vagal nerve stimulation on, almost every type of, whether it's traumatic brain injury, concussion, stroke, Parkinson's. Like Jeff said, when you get that concussion, and we're excited to do our next podcast on, where we have a couple of podcasts just dedicated to concussion. And one of the things you'll find is that they have this nausea. Well, part of that is the vagus nerve is being interrupted, and that needs to be replasticized. So a lot of times we use that vagal nerve stimulation. So I wanted to share what we do in our unit of and how we use the vagal, and like we said, humming, gargling. So indirectly, the vagus nerve gets activated with almost any brain stimulation. And that's because that's functional neuroscience. Because when you fire the brain will fire back down to your pons and medulla all the time, all the time, all the time, all the time. So indirectly, the vagus nerve with the right brain stimulation. That doesn't mean, again, when we say the right stimulation, we mean that the right exercise in the right area, the right side. Not saying right or left, meaning whether you give right or left or both. the right amount of reps. That's all. The recipe is very important to get the customization so the client can get the best out of your program. So basically, when you give the indirect stimulation, and it's the correct for that client, indirectly, the vagus nerve will benefit and get activated. Directly, the vagus nerve can get activated with humming, gargling, breathing exercises, and a TENS unit. So again, in our software, we have a breathing program. And then again, we recommend a TENS unit a lot of times working with our clients. And this is a TENS 7000 unit. I'm going to look on Amazon just to share what the pricing is. So I'm just going to look today on the pricing on the Amazon here, because it's everything we do is looking at, let's see. Okay, so let me go to my browse here. We could bring this up, browse my history here. And this is good. Okay. Uh,
While you're looking that up, Andrew, I'll just add in, as far as the TENS unit goes, from an exercise standpoint, I've actually had a lot of success if some of my clients have eaten too close to exercise and they get nauseous during exercise. I've had them lie on their back and put them on the TENS unit. The nausea has gone away within 2 minutes of using the TENS unit at an appropriate rate.
okay, so here, look at this, Jeff. Watch this today. I'm gonna bring this up. So this is on my Amazon Prime. So you'd have to have Amazon Prime, but we again, it's all about providing value to all of you guys. And this is so this is on today, which is, I don't know when we'll post this, but this is we're in the end of March, so of 2021, and the price is on Amazon Prime $28. So, and then the ear clips, you could source it at like tenspro.com or tenspro.net. They're usually not the best. I mean, they're okay, the clips, but they're usually about $8 or $10. I think you get two of them. So you're talking about with shipping and everything, you're talking about $50 when it's all said and done, and you have a very powerful stimulation. What we do is it comes with a pad. I wouldn't recommend you doing it on your own. I recommend, making sure you work with a practitioner like Jeff and I, or someone you feel comfortable, because again, they're gonna be there. You put the pad, which basically you have a red wire, right? And the red wire goes into the pad. Okay, so like this, put the red wire into here. You put the ear clip. My ear clip. Okay, so you put the black wire, and the reason why you put the red wire, so no afferents go into the heart, right? And you're focused primarily on the vagus nerve, that branch, but nothing is affecting your heart. The black wire goes into the tragus on the left side. This comes with 2 channels. I make it easier if you're doing on the left. I just put it in the left channel, and the way you do it is when you turn without the plug in, you can turn the left channel, open it up from here, and then you press set. I don't usually worry about the pulse width, but I usually manipulate the hertz and the time. And depending on the client, I'll start them off with anywhere from like 3, 5, then I'll build them up to about 10, 15 minutes. Um, and then the level, I usually go where they could feel it, start off with level 2, 3, and then you can increase them. And then you can increase the hertz, to as much as, 50, 60, 70 over time. But I've seen and again, tremendous results. But again, I would work with a skilled practitioner, because they're going to, have, more experience and seeing where you could start out, and they're guiding you and stuff like that. But and I say this, That vagus nerve is one of I mean, because think about it. So many of us, including myself, are in this sympathetic overdrive. I mean, that's what we're living in. That's what our world is. That's what our work and everything we do. So to have that parasympathetic stimulation, again, that's why we have our software. We have a breathing program. Huge. Activate the vagus, activate the parasympathetic system. And then again, that TENS unit. One of the things that I'm looking to do down the road is to develop, I don't think I'm going to manufacture, but I'd like to develop a vagal nerve stimulator to go with an app that can control the settings for the clients. Because because obviously a big part of what I think is going to grow is remote, seeing that telepractice, and where clients and practitioners can see each other wherever they are, and you have a tool like our software to be able to to deliver the programs. And I need to read a little bit more from a physics and engineering, uh, about the different options that I could build that's still very cost effective. And also, I would like to do something with the ear clip that maybe wireless pad, and also that the ear clip is more moldable to the different client's ear. So all these things I'd have to sit down and investigate, probably years away. But for now, the 10-7000 unit is really good. But I think having something that's a little smaller, like comes where people could to do anywhere where they travel and stuff, because I think what's going to happen, and I'll share a little bit off topic, but I think work is going to become a hybrid environment where a lot of people are going to be doing things from home, and then some people it's all home, some people it's going to be home and a little bit of the office, right? And then I think what's going to happen is people, because they're home for their work, I think leisure travel is going to grow. So, but when that happens, when people travel more for leisure, they still at some point need to get their program in, right? So if they're going in to a Caribbean or something, but maybe instead of doing it 3 times a day, then they do it once a day. So if you have their program on their phone, and you have like a very easy travel vagal nerve stimulator, and that's kind of where my concept is. But again, for now, that 10-7000 works really well. But I've seen just amazing results, game-changing results. I've had a client who had a small stroke, TIA, and she had numbness in the left side of her face. And we used the vagal nerve. She's using the vagal nerve stimulator. And I would say that we've improved the numbness by 80% by using the vagal nerve stimulator.
Wow.
So, it's pretty amazing stuff that I've seen out there. And I'm just, I'm excited. I'm just excited to share this this stuff with everyone that's out there, and what we're doing. Yeah, and as far as starting clients off, I typically start clients off with about 3 to 5 minutes, build them up to about 10 minutes. Maybe if I do 3 to 5, I might do it, a couple, maybe 1 or 2 times a day. I've done this before, and I need a lot of vagal nerve stimulation. So, and I usually do much more running. I didn't do as much. I did walking today. So I did it. And what a difference in my stomach. Again, it's not that one time. We talked about the 7 to 10 to 14 days that you start getting these circuits to change permanently. And that's the neuroplasticity.
Yeah, for sure. I'd also like to add in, Andrew, going through assessments with my neuro clients for, eye tracking, vertical, horizontal, so on and so forth. Yes, I'm pretty good at giving a, practical, hey, here's going to be your homework. But I've also, within the session, within 20 minutes of the original assessment, I've just led them through diaphragmatic breathing exercises and retest them and seen better results just off of diaphragmatic breathing. Or even in a lot of cases, if it's, vertical eye movement they struggle with, put them on the TENS unit and come back 5 minutes later, and their vertical eye tracking is better just off of the TENS unit.
Yeah, I mean, but that's and I'm going to talk about that. So just look at that. So you have your eye system, which is part of your vestibular system, And basically Jeff came in there and said, hey, I'm going to do a breathing exercise, which is going to activate the parasympathetic system, right? Which is going to activate the baroreceptors in the carotid sinus of the neck, which is going to, when you're doing the breathing, those receptors stretch. As that receptor stretches, it's sending afferents, right? And it's going to activate your parasympathetic system. Just by doing that, his rechecked the eyes and everything changed. And the thing is like, that is what we're talking about with functional neuroscience, is something as simple as doing a breathing exercise. Again, and you could do it diaphragmatic breathing. We have the software that's a cueing system that helps it a little bit easier to get the exact, breaths that you're looking for. But either way works and very powerful. And that's how
Absolutely.
powerful. And again, in our environment, I mean, that's how we activating the parasympathetic system is just, for a lot of people, not everybody. There are some people that need more sympathetic stimulation, but I would say, for on the whole, you're going to see more people that need parasympathetic stimulation. And I'm up there at the top of the list. Green. As soon as I finish the podcast, I'm getting my green shake with some prebiotics in it, some resistant starches, which help bypass the small intestine, colonize the colon. And because that arugula for me is like magic. It's got your magnesium, right, which inhibits the sympathetic, and it's got the potassium that activates your parasympathetic system. So again, this is, and I'm going to do my vagal nerve stimulation later on tonight, and I'm feeling really good.
Sounds like a good protocol.
So yeah, I mean, I think we wanted to share 10 to 7,000, everything on the left side. We will get back to why, but red wire goes into the pad, goes in the inside of the left wrist, right? The pad, the red wire goes into the pad. So it's basically here's your pericardium, which is, a marker for your heart. So you're making sure that no afferents are going to the heart. You're focusing strictly on the auricular branch of the vagus nerve, right, which is going to activate that parasympathetic. Again, help digestive function, decrease the motility in the digestive system, activate the migrating motor complex of the smooth muscles that move the food through your digestive tract, decrease the cholinergic anti-inflammatory reflex that will inhibit that will suppress inflammation. Again, if you're affecting the digestive system, you're going to modulate the immune system. Immune system modulation, a lot of anti-inflammatory, whether it's supplements, foods, and vagal nerve stimulation. Vagal nerve stimulation will also increase serotonin. Serotonin is a neurotransmitter to also modulate pain, to improve mood, right? And to also precursor to make melatonin, to help cortisol low, melatonin high, dull the pineal gland to help you fall asleep. So also the neural network. So not only just an area of the brain, but the network. So meaning that the multiple areas, the network of the nervous system. And by activating the neural networks, that will help improve neuroplasticity. So if you are doing any type of concussion rehab or concussion exercises, traumatic brain strokes, Parkinson's, whatever rehab you're going to do, adding the vagal nerve component will help improve your results or their function that much greater. So you can do your regular rehab, but you add that vagal nerve stimulator and things will just get that much better. Okay. So, with that said, I really think we did an incredible podcast. Jeff is, like I said, and I said this before, we're always learning from each other. Jeff, tremendous value in the beginning. I'm always learning. And I think this is just another great podcast. And we're here, and I reiterate this all the time. We're here on the podcast there's nothing better in the world. And I'm not going to say who yet because I can't really talk, but someone said that one of their idols, who's a basketball icon, said the greatest thing you could share with people is your knowledge. And that's what all we want to do. We want to share our knowledge and experience. And again, we're not the end all be all. We don't come in here, and we will not come in here saying this one doesn't do this one doesn't do this. Everybody, all we want to say is just share what we do and how we can help, add value. And if you have any questions, you could contact Jeff Rose at Rep, and Andrew Amigo at the Accomplished Brain. So either one of us, we can answer all your questions. We appreciate if you listen to what we're, if we can help in any way. We really appreciate, doing these podcasts. They're exciting. It's a way for us to share our knowledge and to give back and to try to help as many people as we can.
Yeah, definitely. Thanks so much for joining us today, and we'll catch you next time.
Great.